How to choose the right therapist. Studies suggest that with those who suffer from depression or anxiety, therapy in combination with medication is more effective than medication alone. In fact, Barna published a study in 2018 suggesting that 76% of people reported positive outcomes from counseling. Despite these results, studies in 2020 suggest that 56% of people diagnosed with mental illness still never received treatment. So if you're watching this video, congratulations on taking the first step, which is showing interest in therapy. Stick around after the intro and we'll discuss how to choose the right therapist. This is Real Life Psych. For those of you new to my channel, my name's Alexa Asimos, licensed therapist and host of the channel Real Life Psych. Before we start, make sure to hit the like button so we can get this content out to more people who may need it. Also, make sure to subscribe and turn notifications on so that you get alerts every time we drop a new video. Today, we're talking therapy. In 2019, the American Psychological Association put out a study that showed the better relationship you have with your therapist, the better outcome you have in therapy, and that the relationship with the therapist was actually a better determining factor for positive outcomes than the type of therapy itself. So, how do we choose the right therapist? Let's start with comfort. It's important to find a good therapist that you can feel comfortable with, because that's the most important factor when it comes to opening up and being vulnerable. You might have to talk about uncomfortable subjects, possibly share things that you've never told anyone before. So you want to work with someone who you can open up to, and not to mention listen to. But there are so many options and choices out there that choosing a therapist can feel overwhelming. Consider who you might work best with to form the therapeutic alliance. Your relationship with your therapist, also known as the therapeutic alliance, isn't just composed of a bond between the therapist and the patient. It also has to do with an agreement on the goals of therapy and the methods used to reach those goals. The therapist and the patient need to like one another. They also need to feel that there is good communication and a mutual willingness to work together. This is why we recommend that therapists continuously monitor interactions with their patients and check on them in terms of how they feel the process is going. Therapists are encouraged to work on improving the relationship if there appear to be communication issues or problems with trust. Therefore, it's important to find someone that you think you'll work well with. Some factors you might want to consider are gender. You might ask yourself, do you think you'd feel more comfortable with a man or a woman? Age. Do you want to work with someone older, younger, or around your age? Religion. Does it matter to you if the therapist has a particular religious affiliation? And race. Are there certain traumas associated with racial identity or discrimination? For example, this study in 2018 found that female patients who saw female therapists had the highest retention rate, whereas male patients who saw male therapists had the lowest retention rate. Furthermore, both female patients and male patients were more likely to complete 8 or more sessions when assigned to a female therapist. I say that to say the demographic of the therapist actually does make an impact on not only your progress in therapy, but your engagement. It's important to feel vulnerable and open during this process. It's up to you to think about the type of person you imagine opening yourself up to, and this may come with some trial and error. Most therapists don't make much of their personal lives public, but they will often share a few basic facts in their biographies, so you can try and find someone you might relate to before scheduling the first appointment. The next thing to consider is what you think you'd like to address in therapy. Many online sites also ask you to provide some basic information on what you'd like to address in therapy, such as anxiety, parenting issues, or substance abuse. It's really important to look at what your therapist specializes in. And this can look like on their bio that they specialize in anxiety, drugs, trauma-informed care, behavioral disorders such as conduct disorder or oppositional defiant disorder. And the importance of looking at that is if you kind of understand where you're coming from, you might be more anxious, you might want to find a therapist that specializes in that area because they can best help you. One of the other factors to look at are their credentials. Therapists often have a lot of initials after their names, and it can be confusing to figure out what all those letters stand for. While you certainly don't need to become an expert on mental health accreditations, it can be helpful to understand a bit about what the letters mean. So, for example, LCSW stands for Licensed Clinical Social Worker, and this is someone who can provide therapy and also connect you to resources within your community. So sometimes they're in private practice and they can also be in hospital settings and help people who are getting discharged get connected with services. There's LMFT, Licensed Marriage and Family Therapist. That kind of speaks for itself. They focus on working with couples, family therapy, relationship issues. There's also CADC, which is what I have, a certified alcohol and drug counselor that works with addiction and often works with court-ordered individuals in substance abuse counseling. And finally, LCPC, a licensed clinical professional counselor. They can provide therapy and diagnose individuals with mental health disorders. You may see some other variations as each state has its own licensing board and credentialing system. While it may seem a bit overwhelming at first, when it comes to looking at all the different letters, their exact license might not matter very much to you in the end. What is important is to make sure that the therapist you choose is a licensed mental health professional and that they follow guidelines and a code of ethics. This is important if you're looking for a therapy as opposed to a life coach. Life coaches are not required to have a specific degree, and they don't have oversight by a governing board. Licensed therapists or social workers must meet state qualifications, which may include the following: passing a licensing test, passing a background check, performing a certain number of supervised hours, and maintaining continuing education credits. The next thing you may consider is how you'd like to address therapy using theoretical orientation, which essentially means specialized in individual style or approach for a given situation. This one is really tricky and certainly understandable if you've never thought about this. What I'm about to suggest is a huge oversimplification of the many theoretical orientations, but here are a few examples. If you believe there is an unconscious motivation or childhood trauma linked to your behavior, you might want to go to a psychodynamic therapist. If you want to change your thoughts and you think that that will change your life, then you might want to try a cognitive therapist. If you don't ever want to talk about childhood traumas and you only want to be in the here and now, then maybe narrative, behavioral, or solution-oriented therapy are something to consider. If you want to work on your family and not just on you, then try a family-oriented system therapist. Let me say again, that was an enormous oversimplification, but just some insight into a type of therapy that might be best suited for you. Questions to ask a therapist before you meet. Some therapists will offer a free brief consultation over the phone prior to scheduling your first appointment. This can allow you to get to know the person a little and ask any questions you may have. If you're given this opportunity, take it. While a phone call won't guarantee you'll be able to tell whether the therapist is a good match, it may help you narrow down your options when you're trying to choose between several individuals. Here are some example questions I would ask a therapist before meeting them. How often would you anticipate seeing me? What is a typical session like and how long are sessions? How do I prepare for my session? What's your general philosophy and approach to helping? What kind of homework or reading do you give to your clients, if any? Not only is it important to see what they have to say, but how they say it. Studies show a therapist's ability to show warmth, genuineness, and empathy is key to their ability to form a therapeutic alliance. So consider this a valuable screening tool to see if the therapist is showing a level of patience and compassion you'd like them to have. Again, guys, if you've made it this far, it shows that you have a real interest in getting therapy. Remember, there is no one-size-fits-all in your therapist. Just because someone works well for someone else doesn't mean that they're going to work well for you. In future videos, we'll talk about what to expect when you have your first visit to a therapist. That's it for today, guys. Please leave a comment below if you have any experience with therapy or want to share your experience with therapy. I think it's super important to learn from each other. And even being a therapist myself, it's great to hear the perspective on the other end of the table. So please give your feedback and thoughts and have a great rest of your week. Just a reminder that we actually won't have a video next week, so we'll see you in 2 weeks. And I hope you have a great start to your spring. See you guys in 2 weeks.